Well, along with prostate and testicular health, Movember also addresses the issue of men's mental health. Here with a brief look at the issue is a professor of psychology, Dr. Jitender Sareen. So, doctor, let's talk about the guys who are diagnosed. When someone gets a serious diagnosis like testicular or cancer problem or prostate problems, what kind of mental health issues go along with that?
The most common issues are anxiety and depression. People often fear the treatments that they're gonna have to deal with cancer treatments. They often worry about their families. So it's really important to look at the anxiety, especially in the first few months after the diagnosis, for both the patients and their families to recognize, as well as the physicians that diagnose cancer should really be aware of depression that's very common after. About 30 to 50% of people will have depressive symptoms after a cancer diagnosis. Mm-hmm. And it's also been shown that having depression after cancer affects the medical outcomes as well, that people with depression might choose less aggressive treatment for prostate cancer treatment as well as testicular cancer.
So the idea of hopelessness hurts your prognosis and your treatment later on.
Exactly.
How about men who aren't dealing with something like cancer? Guys who just everyday life, what kind of issues are men dealing with?
So men often deal with depression, anxiety, alcohol and substance use issues, post-traumatic stress disorder, especially for our soldiers and our police officers and firefighters.
So what can we do to help? What can we do for those guys when it comes to mental health issues?
I think the first issue is that people are more aware that these things are very common, mm-hmm. and that men themselves become more aware that if they're not feeling well, if they're not able to sleep, if they're not enjoying the Jets game or their football game, then they should really be looking at trying to get help. If they're having symptoms that last for 2 to 3 weeks in a row, mm-hmm. where they're feeling hopeless or thinking about death, they should really look at talking to their doctor. They should try to talk with their family about getting some supports.
Right.
There's also great websites. Movember has a great website, but there's also Anxiety Depression Association of America, as well as anxietybritishcolumbia.com. They have great websites.
So when it comes to asking for help, we often say, guys should be looking for help. What happens when we come to you? Do you guys have a good idea of what's going to happen? Am I laying on the couch? Are we talking about medication? What normally is done?
Yeah. So the common treatments that people access are medications as well as therapy. Cognitive behavior therapy is the most common treatment for depression and anxiety. Very effective, mm-hmm. but the problem is that people don't have easy access to it. And so a lot of self-help, going to their family doctor, trying to get in to see a psychiatrist, as well as a psychologist would be also helpful.
There are options, and it may not be nearly as scary as you think it is. We'll make sure all the links and all the information are on breakfasttelevision.ca. Thank you very much.
Thank you.
We're going to take a break. There's plenty still to come today on BT.
BT Health is brought to you by Sindan Group of Pharmacies, a comprehensive approach to wellness.